Hello, I'm Susan Reagan, host of Connecticut Valley Views, and I am delighted today to have as my guest Morgan Grandjean, who is a veteran office manager and billing coordinator at a surgical practice in Waterford, Connecticut, where she has been for the last decade, playing a pivotal role in ensuring the smooth operation of the practice's administrative and financial processes. With a robust background in healthcare and administration, Morgan has developed expertise in navigating the medical billing and insurance coordination landscape. So thank you very much, Morgan, for spending time with us today, and hopefully we will be an informative interview to help our viewers navigating this rather difficult path. So my first question is, why have you decided to go public on this subject and the insurance industry claims processes, and does it have something to do with the assassination of the United Healthcare CEO? That has played a role, I think.
It clearly has played a role. That situation ignited these discussions. So, but I've been working in this field for the last 15 years. And it has been riddled with, the harsh reality that it is money driven for these insurance companies, and their processes are failing us drastically.
Well, it's very important that we have you on to do this. Now, the insurance industry, whether it's medical, auto, homeowners, it appears to be a legal Ponzi scheme. Would you agree with that? To a degree.
I would. Listen, this is so important for our nation, but also the state of Connecticut. Okay. The taxpayers need to know that this healthcare system is a part of our broken, the broader umbrella of our broken worldly systems. COVID's lasting impact, the current war is taking place, the recent elections at home and abroad. They've all contributed, okay? But the healthcare situation in the United States is dire, okay? For decades, the complexity of the system is making it increasingly difficult to quantify all the issues, really, that need addressing, quite frankly. And ultimately, it hinders access to healthcare and affordable healthcare for, our residents. Costs have risen faster than people can afford. And
Well, let me just interrupt you there for a second. When you say costs have risen,
yes, dear.
now, is it to contribute to the bottom line of the pensions of the CEOs, or have actual costs risen? I mean, is there actually a
Both.
cost factor?
Both.
Okay.
Both.
Okay. But what's expensive about, I mean, if someone has a claim and they want to submit it, why does it get so tangled up? Why does it become so involved? And quite honestly, the things don't seem to get solved either.
You're correct. You're absolutely correct. It's a fragmented system because it creates actually subsystems underneath that all each have their own ways of financing and delivering of care. So there's, it's a complete dismantling of the entire process. There's second, third parties, fourth parties, government involvement on a federal level. There's privatized plans. There are, plans that are just, quite frankly, programs that are being abused and misused, which increase cost. And so, it's really broad reaching. Actually.
Okay. All right. Now, what you've had so many years of experience, and as I've stated, you are a veteran person in this business when it comes to understanding how the process works. What do you see as the largest issue or the most complaints received for people on a daily basis? What do you see? Time factor, no response, not knowing who to go to, not knowing how to submit. What do you see as the largest issue?
All of it. It is honestly, it's all there. They're all equally as bad. It's these issues are all very important. It is by design. It is the system is flawed by design. Um, the essentially there's many reasons for what's happening today. There's few primary care physicians. They're retiring, like in the
I would
next
agree with that.
decade.
Yes, yes.
In the next decade, there's going to be a mass exodus because there's going to be more 2 in 5 actual physicians retiring.
Right.
They're going to turn 65 or older within the next decade.
Sure.
The administrative tasks, prior authorizations, the red tape, and
Why is
and
there so much red tape, though? Why is it not as simplified? Has this been occurring over a long period of time in building?
extremely long period of time, extremely long periods of time,
Okay. Okay.
decades, decades, decades. The spotlight has just shined on this now, and because I mean it's increasingly horrific. Because if you can imagine,
Yes.
for instance, let's say when I first started, I was wondering why I was mailing my Connecticut Medicaid, my patients who had Connecticut Medicaid, I was mailing their claims to an address in Hartford, Connecticut. That was a PO box for Hewlett Packard, which
Oh,
is
good grief.
which was the company that my printer sitting on my desk
Yeah,
was a
yeah,
Hewlett Packard. So I started down this rabbit hole,
yeah.
of what's going on here. Who are the owners
Yes,
of this industry? And this is not care for our patients.
yes,
And the providers are really up to their eyeballs in administrative tasks.
yes.
It's honestly, it's leading to a great deal of them leaving their jobs. The burnout rate is high. Insurance companies are just backing them into a corner in
Okay.
terms of documentation, what has to be done. It's like these practices, especially private practices, like the one I work for, thank God we are still private and
Yes,
able to thrive.
yes.
But we have to hire full football teams, okay, of staff to
Why?
navigate this nasty
But,
web.
but why do they need so many people? I mean, it seems like the more my father used to have an expression, add to the committee and delay the decision. And should it not be such a simple
Wise
thing?
man.
Yeah, yeah. And should it not be that you have this claim and you have this thing and you say, well, why do you need so many people? I mean, is
Shouldn't
it
be this difficult, correct? Well, because there's so many hoops to jump through. There are quite frankly, they make hurdle after hurdle after hurdle.
is it because the insurance companies don't want to pay for these things?
That's
Oh,
correct.
okay,
Yes, wholeheartedly,
okay.
wholeheartedly. While the CEOs that work for these types of companies, healthcare insurance companies, and some of the ones that you mentioned in the
Hmm.
beginning of the interview,
Hmm.
their CEO pay has gone up since 1978. I was looking at the Geneva Economic Forum, the
Okay,
latest information, and that's since 1978. Their CEO pay has gone up 1,400%,
okay.
while employee pay has gone up 18% and inflation 30%. So this is not a sustainable system.
Yeah.
Anyone underneath these individuals in a hierarchical chain, we're not able to thrive and survive under it. So healthcare
Yes.
falls in there.
Yeah. Okay. So Connecticut used to be the center of for insurance companies in the world. It was well known for the insurance companies, well run, well established, employed many people, provided a lot of jobs, seemed to work quite well. Is Connecticut, are the states being impacted from a federal thing, or are the states just, excuse me, screwing up all by themselves?
Well, again, Susan, it's a little bit of both.
Yeah. Okay.
I hate to be so broad here,
Yes.
but it is a little bit of both. They're double dipping in many regards. Okay. So again, because of these subsystems forming and having their own ways of financing and delivering, they make it a little bit hard to track, but there has been such um overemphasis
Yes.
from Medicare and Medicaid plans to with working with privatized companies to offer plans now. Um, that it is quite a cluster for people to navigate.
Yeah, let's be careful of the cluster department. Yeah. Let me ask you this. Would you be able to put a number of any kind on how much money people have been, I guess, unable to collect? I mean, is there a number that the insurance companies have made as far as their uh, profit making?
Profits.
Yeah.
Yeah,
Versus,
I mean, well, clearly it's in the trillions.
okay.
I mean, if you combine these companies, it's in the trillions. We have comparatively, we have about 41% of physicians right now taking out payday loans to
Mhm.
survive. That's
Really?
covering
Wow.
that's covering overhead costs
Okay.
for their practices. That's
Yeah.
also covering their education loans.
Oh.
Now, one of the physicians I used to work for had student loans, excuse me, that were from the 90s because of the predatory nature of them.
Good
They were
heavens.
being sold and sold and sold again, and
Mhm.
the interest rates were out of control. I mean, there is no way with insurance companies withholding reimbursement to
Yes.
these providers
Yes.
with their student loans that they're going to be able to pay them back uh, as they should.
Yes.
It's the whole system is rigged. It's we need constituents in Connecticut to be empowered in their care. It means at home, it means at the office with their physicians, it means with their employers when it comes to understanding their insurance documentation, their
Mhm.
plans, what their benefits are, uh, even holding their cards in their wallets to come to their appointments. Their medical
Yes.
documentation is very sacred.
Yes.
Um, Become involved on a political level, state and local levels will then help infiltrate to the federal level. So, again, all of these things are interconnected.
Okay. If you were to try and put together a marketing plan to straighten this out, where would you start?
Um,
I mean, if you were to try and
I mean, I
untangle.
would start cutting the red tape immediately.
Okay.
I would just start cutting the red tape immediately as far as, what insurance companies are dictating for. It's just too business driven. It is not in the best interest of patients,
Yes.
and the health of our nation. It is just it has become too bureaucratic.
Yeah.
There's too many people involved that shouldn't be.
Well,
Um,
okay, so let me ask you this. One tries not to put their foot into the political lake,
yeah, I
but
understand.
we have a change of presidents coming up. Do you think that this could be one of the things that they could address? Do you see it as something?
I think it's something that they've openly said they'd like to address.
Mm-hmm. Mm-hmm.
Whether it'll be successful or not, I'm not.
We've got to get it tipped the other way. You know, it's got to be to the benefit of the patient. I mean, the patient's
Totally.
already sick, or they have their
Listen,
issues or
and
their
that's also by design. They like us that way.
and they like
Uh,
older people who get confused easily, probably.
yeah, that was part of the problem with CEO Brian Thompson and
Okay.
the discussion around that and I think it's so difficult because people don't want to say, Luigi Mangione, although a murderer, he
Right.
killed not an innocent man.
Right.
That man
He had
had
his own problems. Yeah, he was doing some.
under his rule, right?
Yeah.
There was like in litigation, you can look it up. There was like a $22 million ransomware case.
Yes. Yes.
And there was also, the SEC and the Department of Justice was looking into him for, I think it was illegal trading for the tune of about
That's correct.
$15.1
That,
million
that
dollars.
that's correct. Yeah, he was not. He was
And then you think
punished.
about 50% of the claims being denied, and then elder care and long-term rehabilitation care was actually even higher at 90%.
Wow.
90% denial. It was AI, it was an AI developed technology that they
Wow.
assumed
Oh,
to do that.
oh,
And that is gut-wrenching
yes,
and completely heartbreaking for anyone to think about. And so if you were a United Healthcare member,
yes,
I mean, that is
yeah, yeah. He represented the industry, and
correct.
I think that's the reason why he was killed, was because not specifically did this person receive it. It might not have been United Healthcare; it could have been somebody else. But the point being is, he was an example, and he wanted to set that example and say you can't get away with this anymore. I
Agreed.
think that's what it is. Is that a good thing, killing people? No, not a good thing. It's not
No,
the
I
way
am
to
in
handle
no
things, but it
way. I
certainly
am.
made the news, and it got people's attention, and which is what he wanted.
Well,
That's
that's
what
exactly
he
it.
wanted.
Like the system is by design is flawed. The healthcare system in this country by design is flawed. Luigi designed this happening to
Yes,
ignite these discussions, and this type of spotlight needs to be shined on not just the healthcare industry, but
yes.
many, many here.
Well, to reflect on my own personal experience, I took care of my mother, and my mother actually kind of took care of my father, and then when my father died, and then I took care of my mother. What they said was, "Gee, Susan, your mother's very lucky to have you as an advocate." I think that's something to have, is to have someone who's able to help you through it, particularly for older people. As I said, they're already infirmed in some way, physically or emotionally or mentally or whatever. And so it's very difficult to follow the 4 pages of instructions. You've got to now do this and now send this in and now whatever, but you have to have a copy of this. And you have to email it, but if you want to text it, you can, and blah, 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 blah. So having an advocate, I think, is an important part of this process, so that they have the energy and the ability to sort it out a bit.
There certainly is becoming, yes, job security with what I do because
Yeah,
people are increasingly confused about
yes,
everything. They'll
yes,
receive new cards in the mail.
yes,
They are not sure about the language.
yes,
There are too many responsibilities across the board that they are responsible for financially under the
yes.
plan when they're already paying a large premium to these companies every
Right,
month.
exactly, exactly.
And so why if this should be something that is under my care. I'm seeing now companies transform in huge employers in the state of Connecticut, like General Dynamics, you know, which has United Healthcare for their
Is
employees.
United Healthcare the biggest, would you say the biggest?
For the state of Connecticut,
Yeah.
I would say I'm not sure. It's close to Anthem, I would say, in the
Oh,
state of
okay,
Connecticut.
Anthem, yes. Yes,
Mm,
okay.
yeah, I'm not sure on the numbers there, Susan. I'd have
Sure,
to look at that, but
sure.
United Healthcare is up there in the nation. Yeah,
Yes,
absolutely in the biggie. So, these plans, they're pulling back on what they'll cover, and their language is confusing to even the representatives that
right.
you're on the phone with. So now when I try to read it and understand it electronically, I'll defer sometimes to phone calls because it's not clear. Something that was once covered for these members is
Yes,
now not,
I agree. Yep.
or the language is so obscure that
Yes.
it could be,
It's
they could just,
legally.
yeah, legally they'll wiggle out of it however
Yeah,
they
yeah,
want.
yeah, yeah. They
Uh,
don't do it in plain talk. And I like the way you said, sometimes I'll get on the phone. I'm always solving things with get on the phone, because,
yeah,
20 texts and 30 emails back and forth, and then some legal. But you're right about one thing. They do change the things. You'll get the notices from United Healthcare, and they'll say, we want you to note that, and then you got to read the 2 pages. What changed? We can't, what? That's not covered anymore? Oh, I thought
you
that
should
was
see
covered.
the reams of paper we go through, for
Yeah,
companies and for the federal government who demand that we go paperless. There has
Yeah,
never been more paper
that's
used.
right.
The
That's,
fact between the faxes, the reams of paper, the please mail us these documents, which I don't even know we'll get there. Is that even
yeah,
legal anymore? You're asking me to be HIPAA compliant and use electronic medical
right,
records, and now you're
right.
asking me to print these documents out, mail them to you. I can't believe it. It's just the whole system is it's
Yes,
comical. It really is.
yes.
It reminds me of a good George Carlin skit.
That's good. Give us a sense. You go into your office every day, and give us a sense of what your day is like, your work day is like. You go in there, and
Well, I
what you spend
usually
your.
start the morning off with some angry patients
I
because they
see.
usually,
Sure,
they direct my job sadly is sort of the punching bag,
I
and
see.
sort of
Yes,
I
yeah,
take a lot of the hit for the
yeah,
provider
right.
and the insurance company. The insurance company likes it that way. They really, that's another part of the language game. They really pin it on the provider to make
Right.
it seem to the patient like we are part of the problem when it's
Yes.
really the insurance company asking us to do these things, or they're by design saying, you know what, this patient has to fail this attempt and this attempt at care before we'll even consider, or they need to have a fracture for 6 weeks before we'll even, and a multiple
Right.
set of x-rays
Yes.
to be, exposed to radiation for so much before we'll even consider an MRI or a CAT scan. And or a place of service will be dictated by someone you're speaking to in another country,
Yes.
and that's not even in the same practice or specialty, and
Sure.
has no clue what they're talking about. It's a script behind a computer screen.
Yes.
So many things, as a, circling back to your marketing,
Yes.
what would be a good tactic there? There is quite a bit
Okay.
to be done.
Yes. Yeah. All right. So let's just say that I'm submitting a claim, and the process would be, here's my claim, whatever. Where exactly does one go to start that? What? Give me a, you have whatever, an issue and the thing needs to be resolved. Where does one start?
Okay, so you mean with as a patient or a
Yes, as
pro?
a patient, as a
Okay,
person, yes, as a viewer of this program that we're doing right now. Yes.
okay.
What's your best?
So if a patient has a claim that has been submitted by their provider on their behalf to their insurance
Yes.
company,
Yes.
first of all, it's important that the provider has the most accurate, up-to-date insurance card, because on that insurance card is going to be where the provider is going to need to submit that claim on your behalf. And
Okay.
it's usually in an electronic form. So
Okay.
the provider has to have a platform and software on their computer system that is able to work with their
That's right.
platform,
Yep.
whatever it may be, Epic or a specialty type of
Sure.
software that then sends the claim electronically to the insurance company. And it's usually through a huge clearinghouse like Gateway EDI or something like that.
Okay.
And then they, scrub it and clean it. I'm proud to say that I've had a denial rate of less than 2% for the last
Okay.
couple of years,
Okay.
so which is really hard to do.
Yep.
And and once it comes back, if it comes back as denied, truly unsubmittable, then the provider has a second chance to take a look at the claim and
Okay.
resubmit. If it comes back totally denied from the payer, it goes through the adjudication
Yes.
system, it goes through the payer, it's considered, and then it comes back as denied. That then there is that begins the tricky landscape, okay? Because not every insurance company relays that information to the provider and the patient the same way.
Yes. Well, we've had the experience where, the doctor recommends something, a scan or whatever it may be. And
Hmm.
usually what happens is, and it seems to be fairly clear and it works, is that you get it approved up front. And they go, yes, United Healthcare will cover the scan or whatever it is you're trying to do. Now, once you get a little bit more involved than that, and you do the scan, but now the scan is requiring another scan of another kind, and you have to kind of go through that again. But that seems to have worked for us. We have a primary care physician whose office seems to have that, and we're always having to make sure they have our insurance card is the same information that the doctor's office has, or whatever. But that seems to work. And rather than after the fact that you got the scan and now you want to submit it and see if they'll pay for it.
Oh, correct. So, it also has to do with the place of service. If, the ordering provider is different than the place of service. So what's also a disconnect is a lot of the times where you're getting the study done
Yes.
is not the same place that's getting the prior authorization.
Uh-huh.
So your provider is calling on behalf of, so if something's different, if done different that day, then it could be different and on the hospital or the, ambulatory center where you're getting the imaging, the diagnostic imaging done. So, I'm so thrilled to hear that you've had a good, easy experience.
Yeah, no,
with
that seems to have worked, and
it's not always that easy. It really depends on the plans, and what is wrong with the patient too.
Yes. Yes.
And the treatment leading up to that, and so there's lots of moving parts there.
Yeah. In your experience over the years in dealing with, have you been able to, or do you feel that you're able to respond? You said that your day kind of starts with a lot of angry patients. Do you feel do you feel that you've been able to assuage their issues and their concerns? Do you feel you get that done? Is there a sense of accomplishment? I mean, because perfectly well what they're talking about and the issues they've had.
Of course.
Yeah.
I can empathize with them. Look, I think at the root of this all, Susan, I'm also, on the side working on my own separate podcast about this because I'm so passionate about the subject.
Tell us about your podcast. Oh,
yeah, I'm really excited to be launching.
When is that going to be up and running? When is that?
It's going to be later this year. I don't have a date to give you, but it's because there's so many. I mean, this topic is hot. Listen, it's just I've got to really strike while the iron's hot.
Yes, I agree.
And I have so many stories and voices that really need to be heard. It's very important. But beyond that, I think that we need to come together, think about the complexities, and then just begin, even if it's messy, to tackle.
Yeah, I think it's a big, broad subject, and I hope today we've hit some hot spots and high spots. And is there any way for people to contact you yet, or should they wait to hear about the announcement?
Yeah, you can find me on social media. I'm on X. You can find me there at Morgen Alexis. Morgen is Morgen.
Yes, I did notice that. Okay.
And Facebook the same, and also Instagram at Morgen Alexis.
Great. Well, thank you so much for your time. We really appreciate it. And I want to remind our viewers that you will be able to see this segment along with all the rest of our programs on ctvalleyviews.com. This is Susan Reagan, host of Connecticut Valley Views. Thanking you for being with us today.
Thank you.